Indian PG is the toughest exam in the world, beyond doubt. But MLE, this is the most methodical exam in the world. In this, you cannot pass the exam by ratify. That you mug up this, that, you read this guide. No way, you cannot pass. You got to know your subject in and out. Depth of knowledge, beautiful question they ask. Okay? So with this, how many of you have appeared for step 1? Has done anybody step 1 किया किसी ने? कर दिया. You are writing for step 2. बाकी लोग, you have to write the step 1. So I have taken one topic which is relevant to both step 1 and step 2. ठीक है? This all is where you got plenty of question is there. Slide करो. Slide. Okay. Topic of discussion is today is acid-base disturbance. I'll be talking anion gap also, or RTA, renal tubular acidosis also. These are topics which come in step 1, step 2. Both they come, and these topics are taught to us by physiology one, biochemistry one, medicine, pediatric, critical care, anesthesia, emergency medicine. Everywhere this topic is there in 7 branches. But still, it is not well understood. People passed every medicine, still they are not very clear about the topic. But don't worry, all these topics, this thing, acid base, RTA, and anion, we will revise in just 2 minutes. Okay, I'll make you revise in just 2 or 3 minutes. Puri internal medicine for step 2, I'll make you revise in 3 hours. So first topic of discussion at the moment is acid-base disturbance. So I'll start from very basics, right? Very basics. This you should know. Remember, MLE expect you to know that in and out. Basics should be very strong. If you are not strong with basic, you will never be able to clear. I hope you know. In each step, you need to have minimum 190 marks out of 300 to pass. Yes. If you get anybody, not anybody get below 190. They are not entitled to write exam unless you have to give reasoning, making fail to work. Then only they give, but it's very unlikely that they give a chance to write again. If you are somewhere between 190 to 230, it is as good as not getting 190 marks. You don't get a good residency. If you are somewhere 230 to 240, you are comfortable. And if you are somewhere in 260, you are very comfortable. Got it? So first of all, common mistake by the students. They start writing exam in undergraduate. It's the most blunder mistake by student. If a student who is in 3rd year or pre-final year or 2nd year, he may be knowing anatomy, physiology, biochemistry, but he doesn't know clinical. In MLE exam, there is nothing like anatomy, physiology. Everything is mixed. Everything is clinical based. Am I right? They don't expect you to ratify. That's why I say your basics should be very strong. Mistake, if 2nd year student writing MLE exam, 3rd year student writing exam without any clinical experience, they end up somewhere here, or they end up somewhere here. Got it? So I hope none of you is undergraduate now. Anybody undergraduate now? Okay. Which year you are?
It's a final year.
Final year. Good. You should write after internship. Which year you are?
2nd year.
2nd year. Chale, I welcome you, but don't write exam right now. But do understand the subject. Okay. So I hope it was worth coming here. You learn the mistake what people do it. I have a huge experience where people commit mistake. I'll keep on telling you where you commit mistake. So first mistake is ratify, nahi chalega. Second is writing too prematurely. Don't do this thing. So now, in between, I'll keep on telling you what to do all this thing. Now, we'll read topic also. Other thing I'll keep on discussing in between only. The first topic is acid-base disturbance, which I told you this was the most. You got a lot of questions on this. Yes. base disturbance. Okay. First is the basic concept. Basic concept. How much is the normal pH of the blood? 7.35 to 7.545. The normal pH of the blood. Average we take as 7.40. I'll be using 7.40 as a basic. But remember, normally is 7.35 to 7.45. Anything above 7.40 is alkaline. Anything below 7.40 is acid. Got it? Now, here is the one point which is confused by 20% people confuse here. What is that confusing point? In our school days, we were taught normal pH is 7. In our school physics chemistry, we were taught the normal pH is 7. Anything above 7 is alkali. Anything below 7 is acid. But remember, as per school physics, 7.20 is alkali. But in medical science, 7.20 is acid. This is the one point mistake for 20% students. Samjhayega? Now, normal pH is how much? 7.40 as average, up to 7.35 to 45 as average. So we talk about 7.40 for all easy calculation. Second, normal bicarbonate is 22 to 28 milliequivalent per liter, but I'll be taking as 24 as an average. All calculation we do at 24. Normal PaCO 40 to 45 millimeter of mercury. Till now, what you all have to remember is 7.40, 24 and 42, 45. 3 points you have to remember till now. The first point is 7.40. First is, second is only 24. So ये याद रखो. Third is ये 3 शब्द याद रखो. हो गया? Good. Now stop. We know bicarb is alkali. We have been reading from our school days. CO2 is an acid. We read in our school days. Yes. And this CO2 is controlled by lungs. Everybody knows. Even a student of 6th class knows. And bicarb is controlled by kidneys. Yes, we know. CO2 is an acid controlled by lungs. And bicarb is alkali controlled by kidneys. Agree? Now let's learn how acidosis and alkalosis occur in our body. What the mechanism is? Acid, alkali. Gain of acid is acidosis. Loss of alkali, acidosis. Gain of alkali, alkalosis. Loss of acid, alkalosis. For example, suppose there is one person who is having a lot of vomiting. Vomiting contains what? Hydrochloric acid. Acid losing. So he will develop alkalosis. Suppose there is one patient who has a cardiac arrest and lot of lactic acid accumulates. Gain of acid is acidosis. ठीक है? Suppose there is one person who is losing like hyperventilation. What he is losing? CO2. Loss of acid is alkalosis. समझा गया? तो acidosis can occur. To summarize the whole issue, gain of acid is acidosis. Loss of alkali is acidosis. Gain of alkali, loss of acid, alkalosis. ये basic है, right? We understood. Now, any disturbance of CO2 is respiratory. Any disturbance of bicarb is metabolic. Got it? Any disturbance occur in CO2 is respiratory. Any disturbance of bicarb is metabolic. So these are the basic concepts what we have done now. Having learned the basic concept, now we move on to step 2 of basic concept. This was basic concept number 1. Basic concept number 1. Now we talk about basic concept number 2. Okay. Basic concept number 2. So now basic concept number 2 goes like this. Basic concept number 2. I got one patient right now and I did his ABG and I find his CO2 is increased. So what shall be the disturbance? That's all, I don't know. First of all, there is some disturbance of CO2. It has to be respiratory, yes. Now my step 1 I am using, basic concept number 1 I am using. So any funga of CO2 is respiratory. CO2 is acid. Gain of acid is acidosis. It should be respiratory acidosis. Now I am clear. If I get increased CO2, that is respiratory acidosis. Suppose there is one patient whose CO2 is low. Any funga of CO2 is respiratory. Yes. And loss of acid is alkalosis. So it should be respiratory alkalosis. Increased bicarbonate. Any disturbance of bicarb is metabolic. And gain of alkali is alkalosis. And suppose bicarb is reduced. Any funga of bicarb is metabolic. And loss of alkali is acidosis. Is clear to all of you? So now you know why this figure. This you can make as a box number 1. This is box number 1. This much you write only. This is box number 1. So, so this is what we have learned, basic concept number 2. Now we learned about now we talk about basic concept number 3, that is compensation. Basic concept number 3, compensation. Basic concept number 3 is regarding compensation. Compensation. Now stop right here. Just learn the basic. What is the meaning of compensation? Well, I told you normal range of pH is 7.35 to 7.5. This normal range. And average we were talking about 7.40. Yes. Now, whenever there is some disturbance of acid base, either pH goes below 7.35 or above 7.45. God is the greatest engineer. Body has a mechanism by which body brings back pH to normal, and that is so-called compensation. Compensation means body want to bring back pH to normal in the range of 3.45. I am talking about 7.40. So compensation means equal to 7.40. So write down. Compensation is equal to 7.40 is compensation. Okay? So now check. The ultimate aim is to do compensation. Now how? Let's take a case. I have one patient whose pH is 7.20. What is this? Acidosis, 7.20. His bicarbonate is 10. What is this? Is a case of metabolic acidosis. Why? Low bicarb. CO2 is 42. It's normal. Normal is 42. So he has a normal CO2. This is the scenario. The patient has acute metabolic acidosis. क्या है इसको? Acute metabolic acidosis. Right? Why acute? because CO2 is still normal. So now let's see. Stop writing. This you have to understand. Bicarb is 10 metabolic acidosis being controlled by kidneys and CO2 by lungs. Lungs and kidneys are very good friends. Kidney gives a call to lungs. Kidney gives a phone call on mobile. How are you? Lungs says, oh, I'm fine, sitting in nice place and listening to Dr. Bhatia. Lungs says to kidney. Now lungs ask kidney, oh kidney, how are you? Kidney says, oh, very bad, very bad. Kya hua? What happened? Lung asks, kidney कहता है, metabolic acidosis, pH 7.20, very bad. Lung says, don't worry, I'll help. A friend indeed is friend indeed. Am I right? Both are very good friends. Now, aim is to bring to pH to 7.40. What lungs has? Acid. Normal rate. How much is the normal rate? 14 to 18 is the normal rate. Now, what lungs will do immediately? Look at it now. Lungs will do. What we notice? This increased rate of breathing, increased depth of breathing, lungs is trying to throw out acid. As the acid goes out of body, pH will start moving toward normal. So after some time, the pH becomes, the bicarb becomes 12, this becomes 37, 7.30. After some time, 35, this becomes 14, 7.40. pH has come normal. It has been fully compensated. So it's clear ho gaya? What is the meaning of compensation? Now, 7.60. What is this? Alkalosis. This is 36. What is this? Metabolic alkalosis. This is again 42. What we call as acute metabolic alkalosis. Now same story. Kidney gives a call to lungs. Now how lungs feel happy? Now body want acid. So there will be reduced rate of breathing, reduced depth of breathing. So you can write down reduce rate, reduce depth of breathing. So called, it will lead to, in other words, we can say the patient will go into hypoventilation. Patient will go into hypoventilation. Idea is to retain CO2. इससे पहले यहाँ पे क्या था? Increase rate, increase depth. What was that? Hyperventilation. What is this known as? Small breathing. Small breathing. Typical breathing, what is called acidotic breathing, or small breathing, what we call as. Got it? Now, in this scenario, the body will have hypoventilation. Okay. So now, body will try to retain CO2. This becomes 45. This becomes 32. 7.50. Actual में ये नहीं होता. What happened? I tell you. How we calculate it, just to make you understand what is happening. And after some time, it becomes 47. This becomes 30 or 7.40. Fully compensated metabolic alkalosis. Let's take one more. 7.20. What is this? Acidosis. 24. What is this? Normal. This is 70. Now what is the diagnosis? Excellent. Excellent. It's a case of acute respiratory acidosis. CO2 is increased. Increased CO2 is respiratory acidosis. Because bicarb is normal, so we call it acute respiratory acidosis. Now, lungs is in trouble. Who will help? Kidneys. What kidney has? Alkali what kidney will do? Retain bicarbonate. What will do? Retain bicarbonate, obviously. So now it becomes 28, 65, 7.30, and later on it becomes 32, 62, 7.40. Fully compensated? Yes. Yes? Let's take one more case. I'm writing here. 7.60. What is this? What is this? Alkalosis. 24. Bicarb. Normal. 10 is CO. What is this? Acute respiratory alkalosis. Agree? Now what kidney will do? What kidney will do? Throw out bicarbonate. Throw out bicarbonate 20, 12, 7.50, 18, 16, 7.40. ठीक है? Clear to all of you? Right? तो ये रहे हमारे वो का क्वेश्चन था. Okay. अब कुछ बेसिक क्वेश्चन है, not related to MLE. Just want to make you understand. You can. Some very basic questions. In fact, they are questions of Indian PG exam. Just to make you understand. MLE के question बाद में आएंगे. We'll let's go step by step. कैसे करेंगे? जो आपके पास फर्स्ट पेपर है, आपके पास क्वेश्चन किए आपने? किए? क्या आंसर है? लिखिए आंसर. अब ध्यान रखना पेज नंबर 1 के. Or I give 2 minutes to go through questions quickly now. Yeah. इसको देखेंगे. Look at this question. Look at this question. Look at this question. ये practice question है. Yeah. All of you write down answer A, B, C, D, E. Whatever it is there. You just write down A, B, C, D. What is your answer? Write down. Don't write question, don't write the explanation. Just write A, B, C, D. कर लिया? Done? Write down. A, B, C, D, whatever you want. Written? चलिए. Who says A? Raise the hand. B, C, D, E. चलो देखते हैं क्या है. How much is pH? pH is 7.40. So it has been compensated.